prostate cancer, and they are not doing anything about it right now because his prostate is like the 98th percentile of size. And I was wondering exactly what patch or what I could do to help him, if I could. That's going to stimulate the cancer to grow more, or, you know.
Okay, great question. So this is obviously a significant problem that men deal with. The good news, not in this case, the good news is that for most men, they're going to die of something else long before they would die of prostate cancer. So not to diminish this, because it is a significant problem, and benign prostate inflammation is certainly very damaging for a man's lifestyle. Okay, there's a number of things that can be done here. First of all, my medical doctor, I'm not going to mention his name, I don't want to get him in trouble, but I've had very candid conversations with him, and for years he has been using the combination of DMSO and curcumin by IV to cure prostate cancer. So now, I wouldn't try to do this yourself. I would only do this under the guidance of a medical doctor, but it is possible to take oral curcumin, as long as it's enough and it's a good brand. And some of the research is on BCM 95, although there's other forms of curcumin. And you can take DMSO orally. The problem with DMSO is that it's a very powerful solvent. You need to only get your DMSO from a glass container, not plastic, because it'll leach the plastic out. And DMSO is a blood thinner. So for most people, you only take 2 tablespoons per week. It's not very much. And there's definitely a risk of death by taking too much DMSO, because it will thin the blood. So that is a warning. So that's why I say work with a doctor who is skilled in using it. But my doctor told me that he never saw a case of prostate cancer that wasn't cured from this. He also used this for men with prostate inflammation, where they would get let's say they had very high PSA levels. He would give them an IV of curcumin with DMSO, and over about 2-3 months, the PSA levels will drop down back into normal range. So that's one thing. Now, another thing, one area of research for me is in the amino acid taurine. And this is important to everyone, by the way, not just men. So taurine is found in the brain, the heart, and in men, it's found in the testicles. And what's interesting is we did a research study on this, and first thing is we thoroughly looked at the literature, and what's so surprising is that the mechanisms by how taurine work are not really well understood. Some of the benefits of taurine are understood, but not exactly how it's doing what it's doing. I have my own suspicions based on its composition, but it's a hypothesis. So this is just all to say that as we age, levels of taurine in our body decrease. And so to me, that's an indicator that maybe this is something we want to supplement with if we're not getting enough in our diet. So I'll use an example. Taurine is also found in the prostate. It functions as an antioxidant. So if you're trying to reduce the swelling of the prostate, you potentially can give men taurine, and because it goes to the prostate, it will reduce inflammation in the prostate. Here's some information that the drug companies definitely haven't shared with us, is that taurine is actually more effective than pharmaceutical drugs at lowering blood pressure. Now, if we're actually going to do a webinar on this next week on Lightweight Connect, we're going to do a whole webinar about the health of the heart. So I'm going to get into this in a lot more detail. I'm going to show the clinical studies as reference, as we usually would. But since I'm bringing it up, about the clinical dosage is about 3 to 5 grams per day. And by the way, there hasn't been a toxic level of taurine that's been discovered yet. So that may sound like a lot, but actually it's completely non-toxic. A few other benefits of taurine is that it helps to relax the nervous system. It probably improves cognition. And I wish I had known about this 20 years ago, because studies now show that if you supplement with taurine by the age of 40, your testosterone levels never decline. So you could maintain your testosterone levels at youthful high levels your whole life if you had supplemented with taurine. And this is because, again, the taurine is found in the testicles, and it prevents oxidative stress. And apparently, for men, it prevents their balls from shrinking. That'd be the simplest way to say it. Now, for those of you over 40 who feel that maybe it's too late, I do have some good news for you. There is another antioxidant called alpha-lipoic acid, which you've probably heard of. And there's some new studies that I've been looking at that are showing that alpha-lipoic acid, and interestingly, for those men that are on hormone replacement, the combination of alpha-lipoic acid and testosterone are having some beneficial effects on libido and sex drive, and is a therapy for erectile dysfunction. So for those of you that are interested in that, you can try supplementing with alpha-lipoic acid. And basically, again, what it does is it protects the males. We can still say males today? Yeah. We can protect men's vital organs from oxidative stress. And lipoic acid, by the way, I mentioned it earlier as that the combination of lipoic acid and acetyl-L-carnitine are good for regenerating the mitochondria. Lipoic acid by itself has some remarkable benefits. So I'm going to cover some bases here. For those of you that were going to ask any questions about type 1 or type 2 diabetes, I once met back in 2005 the scientist in San Francisco that was doing a study on controlled release lipoic acid. And what he was doing was taking type 1 and type 2 diabetics, and specifically what I'll tell you about is on the type 1 diabetics. He was giving them 300 milligrams of controlled release lipoic acid, which is very easy to get, and giving them 4 times per day, so 1,200 milligrams per day. He found that only after a month, their need for insulin dropped by over 65%. With lipoic acid, and this goes back to the reason why this works is that alpha-lipoic acid moves sugar out of the body, bypassing the insulin spike. So it can help people become more insulin sensitive. And another benefit is if you take enough, let's say in this study on erectile dysfunction, it was 600 milligrams per day. But if you take 600 milligrams per day, that would be 300 milligrams twice a day. Another benefit in managing blood sugar and helping to prevent diabetes is that it helps your body metabolize fat. So many people that start on that, they see that they get decreases in body fat. It also is very, very good for the skin. So a lot of benefits to using